Hi everyone, my name is Dr. Raj. I'm one of the neurology trainees from Liverpool. And good evening, good morning, good afternoon to everyone from whoever has been joining from whichever location around the world. We are very excited to welcome you out today to our Global Brain Health Clinical Exchange program. We have two excellent speakers talking to us and also an expert panelist as well in our meeting today. Um, so there are a few, before we start, there are a few housekeeping for the session. So this webinar is being recorded and will be shared on the Global Health Network. Due to the number of the participants, your camera and microphone are disabled. Please use the chat function for any technical issues. And also, we'll try to get through as many possible uh, questions and during as many possible dedicated question and answer sessions. We have around 514 people registered for the program today, and we would like to welcome you all to our program. Please do let us know about yourself, about your training grade, about where you're coming from. We would like to know about you all in this meeting. Please type in the chat box, and we're excited to hear from you as well. So today's learning objective is about getting insights into the practice in different settings through clinical exchange with the fellow participants. If you wish to receive certificate of attendance for this workshop, please complete our feedback after the workshop, and the code and link will be sent to you at the end of the session. And please include the title of the event and the code provided when requested. And your certificate will be given to you within a month. So, without further ado, I would like to introduce our chair, Professor Ali Salash, who is a professor from Ain Shams University. He's graduated on 1998 and he's completed his PhD on 2007 and his professorship on 2017. He's a founder of the first movement disorder clinic at his institute and is also an active member of the Egyptian Society of Neurology, and is a clinical coordinator of the Egyptian Network of Neurodegenerative Diseases. He's organized the first Movement Disorder Society School for Young Neurologists in the Africa, and currently he's a chair elect for the Movement Disorder Society in Africa. He has also organized several national and international live and online educational activities in the field of movement disorder, and he is currently nominated as a consultant with the World Health Organization for launching the Parkinson's disease public health approach, global disparities. It's my pleasure to welcome Mr. Salash to our meeting, and I will hand over the slides to you.
Okay, thank you, Rajesh, for this nice introduction, and thank you, Victoria, and thank you, Global Health Network, for inviting us for this important webinar and focusing on the use of telemedicine in education, especially in Africa and underserved countries. It's my pleasure to share this webinar, and it's my pleasure also to have my colleagues, the panelists and speakers. Dr. Melody Asukile from Zambia. She is one of the first Zambian neurologists and lecturer based at the University Teaching Hospital in Lusaka, Zambia, where she manages the National EEG Laboratory. Her research interests include epilepsy, neurology education, and use of telemedicine, patient care and education. She is passionate about finding ways of utilizing their limited neurology resources to reach many people as possible. She recently completed 12 months epilepsy fellowship at University of Cape Town and became the first epileptologist directed the National EEG Laboratory at UTH and is a tutor of 6-month online EEG course. Together with Professor Dina Seiler, she helped set up Teleneurology clinic in Zambia during the COVID pandemic. Also, my other colleague, the panelist, could share Professor or Dr. Bulina Samia. She is from Kenya. She is a pediatric neurologist, associate professor, and the chair of the Department of Pediatrics at Aga Khan University in Nairobi. She has led research projects in epilepsy, attention deficit hyperactivity disorder, autism, and HIV and cerebral palsy in Kenya. And Dr. Samia currently leads the telemedicine task force of International League Against Epilepsy and is an active member of the Research Advocacy and Dietary Therapies Task Force of International League Against Epilepsy. She has provided a consistent clinical service for various neurological conditions in childhood and adolescence from the Eastern African regions for over a decade, which has facilitated her clinical research. Dr. Sami has also been involved as a program director of ACGME, accredited pediatric residency training program. So I'm really honored to be chair this webinar with eminent colleagues from Africa. I think I met Professor Dr. Sami in Nairobi last year. I hope so. I think so. So I start my talk, and as you see, we discuss about movement disorders education by telemedicine, and Dr. Melody will talk about epilepsy, and this is important topics in our neurology field of neurology. So I discuss my experience in education or applying telemedicine for movement disorders. And before starting, I discussed this our publication with our colleagues from Africa, over Africa, about gaps and prospects of education in Africa for movement disorders. And we found that we have like few centers in Africa that teach and train movement disorders up to 40% only. We have postgraduate movement disorder training. And also we have shortage of clinicians and experts and clinics. And we have a lot of gaps, like those experts, lack of training, lack of specialties and comprehensive curriculum for movement disorders, and limited courses and materials. And on the other hand, we recommended to promote online courses and use of telemedicine in education. And as you all know, we have a shortage of neurologists in many countries in Africa, and this is our also published article in Movement Disorder Journal in 2021. We have variations, and many African countries, we have less than 5 neurologists, and some of countries 1 or 2. So this is a big challenge. And we try to be specialized, but I think we all agree that we have to cover all the neurological aspects and field in our countries. So also I start by this from MDS survey about challenges for education in Africa. And can you see that's the expensive, and the location of the program is too expensive, and also gestation fees and traveling fees and travel restrictions, also one of the like challenges for in-person education courses in Africa. In addition, also to unstable political or problems in Africa. Also, we have other problems, but this is the main problems. That's maybe in-person training is not available, or is difficult for many African colleagues. So to reach out those people in different countries, we have telemedicine is a perfect tool to reach out 1 or 2 neurologists in Chad or in other countries, small countries, or maybe also reach out clinical practitioners. And I was honored to chair the educational committee for MDS. I was the first chair because the African section of the Movement Disorder Society, which is the biggest society for movement disorders in the world, and we have thousands of participants in different countries. Africa is in 2017 started to officially organize the section. And I was honored to chair the education committee for 4 years. And it was a bigger challenge because we have different challenges and different problems compared to other sections or other continents. So from the start, even before COVID, but this is also, of course, in case during COVID, and we continued after COVID, we started our online teaching as a basic basic tool of our plans. I think we were more than other sections or continents use the telemedicine. And we try to like organize innovative programs, because telemedicine we try to be more interactive with participants. So we started our multi-center movements all the grand round. We started our interactive course, and we have also annual French English virtual course, because also language variability is a big challenge, and French speaking countries may be not engaged in English courses. So we have at least annual French Day of Basics of Movement Disorders, in addition to other programs like cooperation, center programs, and collaboration with African Academy of Neurology with Movement Disorder Teaching Day. And finally, we have a nice program by our Professor Kotma from Canada and approved by MDS Africa, asynchronous consultation movement disorders. You can ask consultation for any patient through WhatsApp or site, and expert will reply to you. And all these programs were for free, because MDS membership still free for African colleagues. So this is a big advantage. So our first program was multi-center movements order grand round, chaired by me and from Cairo and Shalash University, and Professor Carr from South Africa, and Professor Samia from Tunisia. And we had five webinars per year, and composed of lecture followed by Q&A, and we discussed the nice cases live from different centers. So we try to engage many countries and many centers in this program. And this program, we reached up to more than 400 attendees in our program. So it was like a successful program, and we received a very encouraging comments. The second innovative program was the virtual interactive course, Principle of Movement Disorders. And I acknowledge I learned this program from epilepsy. So we tried to do like a platform, using a platform, continuous platform by MDS. And we have 5 modules, each module 2 weeks. So we have a program for 2.5 months. And each module, we have 2 weeks. Week 1 for recorded lecture, questions by the candidates and attendees. And also we have activities. We apply activities for different groups of the participant, and they should reply or answer this activities by the 2nd week. And also they could discuss any cases in this platform. So it was like a new format of education course, and it was successful. We had up to 200 or more than 200 applications, and we have to accept only 100 because of we need a limited number of participants. And as you can see, you will find this platform, and the group work together, about 10 clinicians from different countries, and apply or submit one answer on behalf of them, and the faculty will review it and send his comments. So it was like a new innovative course, and interactive also for and engaging many neurologists in Africa. And so our outcome was very like fantastic. We have up to like 6 courses online during COVID. Maybe I only give an example for 2021. We have about 870 registrations and 83 education hours and about 60 faculties. So we succeeded to reach out about 870. Not all from Africa, but also we have other from outside Africa. Also, another nice experience, our program were by MDS, not only by Africa and Egypt and Ethiopia, with the first African center-to-center program. And this program, we have mentor site in Cairo, in Shams, and Minty in Addis Ababa University. And we connected by in-person visit, but also by platform and WhatsApp messages. So we can like answer any questions or any cases, consultations. So it was also important course that we can develop or increase communication between different centers in Africa. Finally, I also, not only for education, but we adopted also telemedicine for patient care during COVID. And I think now in our clinics, we use it more than before COVID. So this is our, I would like to share this experience in different programs we organize in Africa. But of course, as you know, we have some challenges, but for using telemedicine in Africa, like internet problems in some places, less interactive. But as you saw, we tried to increase interactivity and discussion through different innovative formats of courses. And also not suitable for acquiring skills, but we tried also to cover this, but to some extent, different time zones, that is not big problem in Africa, but maybe all over the world, it could be a big problem. Distorted clinical signs like tremor. So it is better to share the videos before the session because sometimes slow internet will give you slow tremor frequency. And also it's communication and social, but also we try to encourage participants to work as a groups or as a team from different countries. So this is my highlights. Sorry for my longer time. And now our quiz, Raji. Okay. Thank you for your responses. I agree with the most of you that telemedicine is essential in addition to the in-person education. Thank you, everyone, and thank you for having me. And now it's my pleasure to introduce my colleague, Melody Usoki from Zambia, and she will talk about using virtual teleneurology in EEG training, and this is an important topic for any neurologist. Melody, the floor is yours.
Thanks so much, Prof. Shalash, and thank you for a very great talk. It's really, we learn a lot from the Movement Disorder Society. So today I'll speak about the role of telemedicine for EEG education. Okay, so the only disclosure is the program I'm going to talk about. I'm a tutor on that course, so perhaps I have a little bit of bias. So just before we start, I just have a question for the group. Do you have a neurology training program that incorporates EEG analysis training in your country? So you have a neurology training program and you're also trained on EEG analysis in that program, or you know of such a program in your country? Okay, great. Okay, so it's nice to know that majority of people do actually have training programs, but we can also see that quite a big number, almost 40%, do not. So today, I want to talk about telemedicine in sub-Saharan Africa. I think Professor has given us quite a good overview, particularly in the field of movement disorders. So one thing that is evident is that low middle income countries have the fewest neurologists per population. So we have from other studies that have looked at the global burden of disease, there's about 0.3 neurologists per 100,000 people. And yet we've got the largest neurological disease burden, especially because of the burden of infectious disease and also growing non-communicable diseases such as stroke. So telemedicine is the use of telecommunications or virtual platforms to provide healthcare remotely, and it may improve access to limited specialist care in sub-Saharan Africa. So in the past, most of the telemedicine that we've had in our region has relied on international experts from what we'd call the global north. But over time, we've had growing local expertise, even though the numbers are small. And so thinking about using telemedicine in our region to expand access to the limited expertise could be an option. However, as Prof also mentioned earlier, the use of telemedicine has several limitations in our region, usually due to lack of infrastructure and lack of access to reliable internet services. The growth of mobile phone networks has really improved this. And I think one thing that pushed us towards use of telemedicine, not just globally, but also in low and middle income countries, was the COVID-19 pandemic. And we saw that more and more people were using telemedicine. And that's how even such meetings or webinars like this one arose. So what about using telemedicine for epilepsy and EEG training? So given that neurologists are very few in Africa, and particularly those who are qualified or specialized in EEG are even fewer, the University of Cape Town, in conjunction with the World Federation of Neurology, thought about developing an online EEG teaching course. And so this is a 6-month web-based basic EEG analysis course that's called EEG Online. So EEG Online has been there for about 7 years now, and we've had over 1,500 registered learners. And majority are from this region, our target region, which is sub-Saharan Africa, so over 90%. And hence, we believe it is building capacity for EEG in sub-Saharan Africa. What is also beautiful or ideal about this course is that we're using regional experts who provide up-to-date, but also regionally relevant content. So this is just some of the features of our EEG online course. So it's structured as over 6 months, as I mentioned, and it's got 9 modules. And each of these modules has got what we call multiple modalities or multiple ways of learning. So there's illustrative text, which are like lecture notes with pictures. And then we've got recorded audio and video lectures, and also links to some external sites online. We've got these interactive EEG epoch activities. So you get to see snapshots of EEGs and you interact with it. So for example, here in this text, if you click on the blue text, it will highlight the blue. If you click on the green, it will highlight what's green. And that way you interact with the EEG. One thing that's quite popular with our course is at the end of each module, which usually lasts about 2 weeks, there are these immediate feedback quizzes. So you get 30 questions of different EEGs, and at the end, you are given answers with explanations to those EEGs. Then we also have discussion fora. These are not online, or let me say, they are not synchronous, but they're asynchronous. So learners look at EEGs and they post comments, and later the tutors will go through and discuss those. So it is self-paced learning, though it's got time limits through the course. So these are some of the features on our course. So we thought, though, was this training method actually effective? Was this EEG online course actually training people in analyzing EEG, and did they feel that it was improving their analysis? So what we did is we did a study to analyze, or rather to evaluate the effectiveness or the efficacy of this online tool for EEG teaching. So this was a prospective cohort study, which we conducted, and there were 128 learners who consented to be on part of this study, and included neurologists and neurology residents and neurology technologists. And of those, about 70% completed the study. So the study comprised of a pre and post-course multiple choice question test, and for which assessed knowledge acquisition, and then pre and post-course surveys, which assessed satisfaction and confidence. And then we also looked at the use of course materials and the user logs, and correlated that to performance. So if someone used the course more, would they do better? And so what we found was 2 things specifically. So we found that there was a significant increase in knowledge, particularly for the neurologists and the neurology residents, where we had the most numbers. So you see from the first test before the course, people were getting less than 50% in the tests, but after the course, they were getting over 60%. So that was a significant improvement. And what was also good is that it correlated with their overall confidence. So on this figure on the left, this is self-reported confidence in reporting EEGs. And you can see the confidence was really low before the course, and it skyrocketed after the course. So we found this really useful. Another really important finding was that the largest improvement, when we looked at selected components of the EEG, largest improvement was in identifying normal features and artifacts. So this is very important because abnormalities can be quite obvious, but then erroneously calling a normal EEG as abnormal can have serious consequences. So the improvement in identifying an EEG that is actually not abnormal was pretty important. When we asked the users how they felt about the course, everyone or majority were felt that it improved their EEG analysis, and over 80% thought that it improved independent EEG analysis, and many thought that said they would recommend such a tool for teaching of neurology, not only for EEG, but in other courses as well. So in conclusion, our study demonstrated that this multimodal online EEG tool was effective in improving EEG analysis and interpretation skills. And we think that it may be a useful supplement for EEG teaching, especially in resource-limited settings. And we also encourage the development and evaluation of further online neurology teaching tools. And I must say that we have seen this growing. We've just heard about movement disorders, but we've seen it in stroke. And we've really seen a growth in using online learning for different courses in neurology. So this is the website for anyone who might be interested in signing up to the EEG online course. So in conclusion, I just thought I would mention one opportunity. I know Raj will talk about more opportunities in neurology, but I thought to mention that in Zambia, in our Zambia neurology program, we are doing, we've got these virtual neurology lectures. So Zambia has got a special neurology training program where we rely not only on local faculty, but also international faculty. And in the beginning, these were faculty who would visit our hospital physically and spend some time. But during COVID, we then learned that a lot of them could help us with lectures and tutorials online. And so this has continued even beyond COVID. And we now have people attending our lectures from all over Africa and even all over the world. And so what has changed now is we're having these lectures recorded, and they can be accessed free on this website called VUMEDI. So this is a platform where you register, which is free registration, and you can access lectures in different topics, epilepsy included. All right, thank you so much.
Thank you, Dr. Mehdi Asukile, for this nice experience. And I agree with you, EEG is one of the important tools for neurologists. Myself, in my start, I thought I need to have some online EEG courses by International League Against Epilepsy, but it was like paid, but with waived for low-income countries. So now we have a free registration course. And really thank you and congratulations for this great work, for this important skills for neurologists. And any comments, Dr. Pauline? Would you like to have comments about?
Yes, first and foremost, I'd like to thank you, Prof. Ali, and as well as Melody. I saw a message on my computer. I got a bit worried. Somebody spotlighted the video. So yes, I'd like to thank both of you for really excellent presentations. And for the sake of our speaker, our attendees, I just wanted you to probably talk about the steps, things you had to do in order to have your courses become successful. It's not easy, it's not straightforward. Maybe we start with you, Melody. What did you have to do in order for your course to be so successful?
Thanks, Pauline. So that is indeed an important question, is that these courses, they do need resources. And so I think for us, what was really helpful is we got an education grant from the World Federation of Neurology. And this is an opportunity that's actually open to everyone. The World Federation of Neurology has got what they call a grant in aid, and they particularly support programs that are education oriented. So funding is very important, because setting up the course can be done by individuals, but putting it on a website and having it posted on the website, having the course actually managed by software developers, you need money for that. So I think that was the first step. And then so the EEG online course is not completely free. We do get fees, but they are staggered depending on the income of your country. And in many cases, actually, participants do get waivers. If people actually write and say, look, I actually don't have money, the course tries to cover the cost for that, because we understand the need for the training, especially in our region. And so the cost that we charge is really for the running costs, but these are most often waived. So I think that is the biggest thing. And then the next thing, I guess, is you need to get the course known. So you get it out there that people know that it exists. And I think even before it was launched, we had to do a lot of publicity. And most of the publicity we did was really just at local neurology or national and international neurology meetings. So we presented like at our regional meetings, presented at any international meeting, we're talking about this course. And so by the time we launched it, there was quite good information about this course going. And though the need was so great, it was obvious. I saw many of our participants say they have a training program, but I think, for example, in Zambia, by the time this course was starting, we didn't even have a neurology training program, and very few centers even have EEG training. But this course is quite comprehensive, and you get exposed to hundreds of EEGs over the course. And that is, I think that's one of our ways of getting people to actually learn EEG, and we've seen benefits in that. Yeah.
Okay. Thank you, Melody. Dr. Charles, please. I see you raised your hand.
Yes.
I see.
Yes, thank you. Just to emphasize that I think that the course on EEGs is critically important, because the difficulty is that we see a lot of people have now got EEG machines in sub-Saharan Africa, and the reporting is just can be very, very variable. And often a patient will come to us, I work on the Kenyan coast, will come to us with 1 or 2 pages of EEG with a report that doesn't seem to tie up at all with what I can see on the EEG. And I can't emphasize how important these training courses are in order to try and improve the technical aspects of performing the EEG, but also particularly the interpretation.
I agree with you, Sarah. Even in Egypt and many countries, we have like misreadings for EEG. And of course, we have also misuse of EEG. Many patients don't need for EEG. And I think, as Melody commented, you might need these courses to be more confident about your skills about EEG. So if I see others from other countries, advanced countries, or express, so I can be more confident and we have less mistakes about misreadings EEG. Totally agree, sir. There's questions from Genesis asking about the course is only for neurologists. I know what is means, maybe general practitioners or maybe.
Oh, thank you. So I think, as Prof. Newton has mentioned, EEG is a very important tool, but it also needs to be used correctly. So then you need to have some understanding of what the EEG is for and how it's used. So we do recommend neurologists, neurology trainees, and those who are neurology technologists, so the people actually conduct the EEG. In some countries, psychiatrists are the ones predominantly seeing patients with epilepsy. And so we have had psychiatrists join as well. We've had neuroscientists who've joined the course as well. So we don't exclude people. If you have an interest and you can demonstrate that you are using this in an appropriate manner and that you've got the necessary background to do the course, then we would consider the course. So it doesn't segregate or exclude people, but we do recommend that it's for people who actually be using it appropriately and have an appropriate training background. If I can just add as well, from Prof. Newton's point, so with our course, this is a basic EEG online course, but we're actually going to move forward to an applied EEG course where participants will be getting longer strips of EEG and marrying it more with clinical interpretation and imaging results. So we are soon hoping to launch what we'll call the applied EEG online course. And so those who've done the basic one can look out for that as well.
Okay. Thank you. And also, I think I agree with you, not excluding people, especially like internists or pediatricians, because we have in some countries limited neurologists, as you know, Melody. We have important questions about medical legal issues regarding consulting cases for through telemedicine. Any comments? Samia, Melody. Let me start by answering. We had like a survey about telemedicine in Africa, especially movement disorders, and we don't have in Africa in many countries like clear or strict issues recommendations for using telemedicine, but I think in general we have some recommendation that's if you in your place you should first see the patient at least once in person, and of course it should be like respect confidentiality of the patients and his place. And for sharing cases with consultation, I think it could be acceptable if we have also approval from the patients and their families to share their videos or their data. I don't know about, what do you think, Dr. Pauline and Melody? Pauline, do you have any comments about this?
Yes, really, our session today is mostly about teleeducation, which I would say is a really safe space to be talking about the virtual space. The clinical application for telemedicine is a little different. And a lot of times you need to have seen the patient, and they need to have probably even signed a disclaimer in your clinic that they are happy and they understand the limitations of the telemedicine session. You're not going to be able to touch the patient, and there are of course risks of miscommunication and those kind of things. So telemedicine for education is extremely useful. I have a telemedicine hour every Wednesday, 12 to 1 o'clock. But these are, as you say, are for patients who I already know and they all sign a disclaimer. So we all have different legal frameworks, and telemedicine in neurology is useful for both settings. So yeah, there is also a question about telemetry, and they ask, do you also use telemetry, which the EEG is accessible to a consultant? That's interesting. The question is not very clear, and I think it goes to Melody, because I think there is a bit of a mix here between clinical work and teaching. What do you think about that question?
Yes, so I'm not sure what this question refers to. I mean, in clinical practice, we
I think he maybe indicate that the expert outside your country could access to the EEG and read him by himself, just sending batches or species. I think so.
Or maybe is this outside the course? Do we do remote EEG reporting? I mean, so that's another option in many low and middle income countries. They might have a technologist or a technician, and they have the EEG machine, but they don't have the capacity to analyze the EEG. So in some centers, they record the EEGs, and then someone somewhere else reads them online. So in our country, we do that with some of our centers, and other people do that. But with the EEG online course, it's already got EEGs uploaded that are part of the course. So we don't necessarily import real-time EEGs. So it's EEGs that have been de-identified, anonymized, and they're already within the course. So I'm not sure if that's what he was asking, or he was asking something else.
Okay.
Yeah, but Melody, even in places where we have some limitation in availability of resources, the truth of the matter is, during an EEG recording for a patient, you actually need the technician to be able to observe the patient and make notes of certain events as they occur and how they affect the whole EEG recording. So there are pros and there are cons. For education, as you say, it's very clean and very clear. For clinical purposes, there's sometimes limitations. You would need a lot more information about what was going on to be able to interpret an EEG where there is no suitable technician. So what you're doing is most likely the best way to go about it. Let us have people who understand how to record a good EEG and how to help interpret a good EEG. Great. But Professor Shalash has not had an opportunity to also tell us about how he went about setting up his training program. I think it's a question that cuts both sides.
Okay. Thank you, Pauline. First, I would like to, like, as anyone in Africa, I am not also exposed to easy to travel outside. So for myself, I started to build my knowledge through courses online. And now we have a variety of opportunities in different fields, and many societies maybe give a chance for free for courses, online website material, and so on. And when I nominated as a chair of the education committee, it was like a challenge, as I said, and of course, by help of my colleagues in Africa section, and I can see Professor Mashari from Zambia is here with us, is one of the supporters and started this work with us. So first, I met lots of my colleagues in person cases from Africa, and one of these programs was like an idea from one participant, my colleague. So he said, why we don't just make a long-term course for movement disorders? So it's important to learn from others, to learn from other societies or other programs. Like I said, I think Melody knows that there's like a continuous program for EEG learning in International League Against Epilepsy, and you have to learn online and share EEG from your side and other side. So I learned it from this. So I started to try to think how to reach out my colleagues to be the courses more interactive. And actually, when I shared my ideas to the MDS, most other officers or leaders, they were very supportive, and even they changed the teaching platform, education online platform, just so we can like create or implement our ideas. So it is a process of learning from others, try to think how to make it better, maybe more innovative, and ask the target audience or target colleagues how to do it better. So by this, and this is why I think we did a good work in our courses. We have a questions from is there telemetry is used in pre-hospital care where a higher qualified person can read? Yes, as I said, for instance, ECG, the questions of EEG was similar to this. Can it be accessible to the consultation modes? I think it is accessible. Now we have computer programs, you can share your screen and your EEG. Sometimes I travel outside Egypt, I can read my clinic's EEG by these programs. So I think it is available. And as you said, now telemetry is used for stroke, for cardiology, for radiology. I think it is accessible and could be applied cheaply. Any questions or comments? So before ending our webinar, I think it's a good opportunity to hear from Pauline and Melody, and we all maybe meet sometimes in Afan or other meeting. We know the challenges in Africa. So what is your recommendations for like promoting treatment and promoting education of neurology in Africa? Pauline, can you start, please?
All right. First and foremost, it's about sensitization and targeting specific groups. We in Kenya have been very lucky. We've had a grant from THET that allowed us to do the pediatric epilepsy training. And initially, before COVID, we had quite a number of courses run, approximately 3 of them. Then we still had funding, and then COVID hit. So COVID was really a turning point for us in our own way. And once the British Pediatric Neurology Association was happy to support the virtual courses, we were among the first people to sign up. So this has helped us to sort of widen the reach. And so one of the things we've had to do is sensitize people, nurses, doctors in remote areas who come into contact with, well, children. I'm going to be biased here because I'm a pediatric neurologist, and who come into contact with children who have this kind of presentations and they're not 100% sure, so that they can make, at least an initial thought or diagnosis of epilepsy and either refer the patients to the correct centers or even administer rescue medications in the first instance. So virtual education in neurology, we have used it to help us move forward with the PET-1 and PET-2 courses and to reach a lot more of the healthcare workers in our country. So we were lucky, as we say, funding is a part of the help, but even more so, it's about getting people to be committed and people to actually deliver on the courses. So I don't know what you people have done to keep the courses going, but what we have done is that in 2020, we also had a wonderful opportunity through various funders to get the pediatric neurology fellowship program running. So before our graduates, before our fellows graduate, then they attend the courses, the pediatric epilepsy training course, they become instructors, and the new directors are now our old residents. So that way, then we always have a new group of people who are able to help deliver on the courses. And believe you me, the future is bright for this particular course. So maybe Prof. Ali Shalash, you can tell us also, what's the next step? I think we did hear from Melody what the next step is. Maybe you can tell us about challenges that you have faced and what is the next step for the movement disorder training course.
Okay, thank you, Pauline. Before concluding, because we have concluded our session, I think next step or further step, as you said, we have to be committed. We have to share the opportunities for all our colleagues, how to learn and the core online courses, and also how to apply what you learn it in your country. So we in Africa, we have like a brain drain. Some people learn and not come back. No, we need someone to guide and share his experience over Africa, virtually or maybe in person, but please share the information and try to learn more and more. We have a shortage for care for people who should care by our patients. So at the end, I think it is a very nice session. Thank you, Dr. Melody from Zambia and Dr. Pauline from Kenya. And as you all here, please don't go, because we have some opportunities from Brain Health Network. And I think through this hour, we recognized successful educational programs in the fields of movement disorders and epilepsy or EEG. And finally, I want you all to be more committed, be more enthusiastic to gain knowledge through online courses, and you can build yourself and your experience in the neurology by using these programs, and also share with others. Thank you all for this wonderful webinar. And before going, Raji will share the opportunities by Global Health Network.
Thank you, Prof. Shalash, for the talk, and it was very interesting talk from yourself and also from Dr. Melody. I will just share my slide about the opportunities that are available for perhaps So it was an exciting talk, and thank you to everyone who has attended to the session for the talk. We just like to talk about the opportunities and resources available for people around the world for improving the global neurological education and the training. Before we go for the opportunities, I would just want to ask if there an impact poll about one thing you would do differently or act on as a result of attending the workshop. And also, will you use your knowledge learned today to educate both colleagues and the patients? Um, so please submit to the poll. In terms of our opportunities, as we can see here, so we have a scholarship opportunity for Liverpool Neurological Infectious Disease course, which is happening on 19th and 20th of June 2024 at Liverpool Medical Institute. And it's a 2-day course with a specific for clinicians from all grades with interest in neurological infectious diseases. And there are scholarships available for the national from low and middle income countries, and which would cover the cost of the registration along with the £600 worth of expenses for the travel and accommodation. So please use the QR code, and the deadline is today. If you can apply for today, that would be great. And we look forward to welcome you to Liverpool soon on June 2024. Please stay up to date with us and attend our next session, where we are excited to welcome our upcoming competition for the clinical exchange program competition. And this will be updated on April 2024, and the prize will be a free place to the Neuro ID course plus travel and accommodation cost up to £600. There are PhD opportunities available from the Liverpool for the health priorities in Global South. These are clinical PhD studentships. These are for the UK registered healthcare professionals, and the successful applicants will be based overseas and spend 3 years in lower middle income countries. And please use the QR code for application, and you can email any inquiries to this particular email. There are also mentoral fellowship available from MS International Federation Society. They fund a 2-year research placement for the early career researchers from the lower middle income countries. And the fellowship consists of 2-year grant, around £30,000 per year, and also covers the travel and living cost and additional contribution of £2,000 per year to the host institution. And the closing date is 30th of June. So I would also ask you to join our collaborative network, where we have developed research tools which will help to unify the reporting and methods used by the professionals across the globe. So please use the link and look into our resources that we have, which has tools and podcasts and scoring systems and training videos for the research in the neurology health. And there are free e-learning modules for the neurological infectious diseases as well, which is aimed at the medics from all grades, from the undergraduate students to the consultants to senior academics. Every year we do run our encephalitis international conference. It usually happens in December, so please keep an eye on this, and the registration will open later in the year. And there are so many opportunities available as a scholarship for free in-person and virtual places for people from low and middle income countries. So please keep an eye on this, and we'd like to meet you in London this year as well. Join our collective network for neurologists, neuroscientists, and health specialty professionals to create the research environment to tackle the problems of the global neurology as well. And last but not least, obviously, World Federation of Neurology also has a free e-learning hub where you can access various training materials for people from all grades of training, from the undergrad to the consultant level. So please feel free to use these sources as well. And we'd like to thank World Health Organization, Brain Health Unit, and the University of Liverpool for funding this clinical exchange program. And we are excited to hear from every one of you. And we'd like to invite you to our next session, which is upcoming on 26th of April. And I think the registration link has been put on the chat box, so please use the registration link, and we look forward to welcome you again next month. Thank you, everyone.